Hi, this is Elliot Fishman, and welcome to part 2 of our discussion of pulmonary artery aneurysms. We mentioned before that CT is the ideal way of detecting suspected or unsuspected pulmonary artery aneurysms, and CT is the study of choice for looking at the pulmonary arteries in general. We talk about the importance of a rapid injection of contrast, ideally 5 cc's. We start scanning at a trigger point of about 200 Hounsfield units in the pulmonary trunk as the region of interest. And then we reconstruct with thin sections. Typically, we'll do 0.75 millimeter thick sections at 0.5 and 3 millimeter thick sections at 1 millimeter intervals. That works out very nicely. The scan time is under 10 seconds. We talk about involvement of the more peripheral branches and multiple sites of aneurysm formation. When you see multiple aneurysms, of course, you think about things like connective tissue disease, you think about vasculitis, and that's especially true in younger patients. It can be seen in Behçet's, we mentioned that before. Also, Marfan syndrome are possibilities. And again, one of the things to consider, we talk a lot about vasculitis these days. It's becoming more common. We look at vessel wall thickening. We look at stenosis. But we need to look at aneurysms and pseudoaneurysms, including the pulmonary artery and their branches. With Behçet's, for example, the aneurysms and pseudoaneurysms are more distal in the smaller vessels. So that becomes important. Nice example here of a patient with shortness of breath and pulmonary hypertension. You can see the right main pulmonary artery aneurysm with some thrombus present, very nicely shown on the axial and the coronal volume reconstructions. Again, embolization's a possibility in this case, but surgery will probably more likely be done. Here's a patient with a larger pseudoaneurysm, and this patient typically would present with coughing or hemoptysis. These are the ones you really worry about, because just looking at this whole process, you kind of look like there's a big pseudoaneurysm present, and there probably was some bleeding. Again, this is probably not one that can be embolized. This is one where surgery becomes very, very important. This patient underwent lobectomy, and pathology showed a sarcoma in part, but also this large pseudoaneurysm, very nicely shown. Now, we mentioned before that pseudoaneurysms can be due to trauma, which can be stab wounds, or iatrogenic trauma, including Swan-Ganz catheterization. We talk about multiple pseudoaneurysms with endocarditis and septic emboli. We talk about infection, again, mycotic aneurysms. One of the things we think about with IV drug abuse, though it's uncommon, is pulmonary artery aneurysms and pseudoaneurysms. The classic Rasmussen aneurysm, which is better described than commonly seen, which is due to tuberculosis, but probably in third world countries, you're going to see it much more commonly than you are in the United States. And here's just another example of a large pseudoaneurysm with thrombus present. This case does make the point, as does the prior case, that at times pseudoaneurysms can be confused with necrotic tumors, or maybe a tumor invading the pulmonary artery. This patient underwent resection with lobectomy, and again, this was a pseudoaneurysm, as well as some malignant tumor present as well. Now, with mycotic pseudoaneurysms of the pulmonary artery, we talk about right-sided endocarditis, necrotizing pneumonia, syphilis, and of course, tuberculosis. Here's a nice example of a patient with a smooth-walled right middle lobe lesion with slight enhancement. This was a pseudoaneurysm. The enhancement of the pseudoaneurysm matches that of the left atrium. So again, sometimes you have to be careful, because if you're too early When it's in the arterial side, the pseudoaneurysm or aneurysm may not enhance, and you may undercall things. It's a very nice example here from the axials to the cinematic rendering, nicely showing you the patient's pseudoaneurysm that's present. And again, here it is again, pulmonary artery aneurysm near the right hilum. On the earlier phase imaging, you can see the aorta is not very bright, the pulmonary artery is, but sometimes there's delayed enhancement of pulmonary artery aneurysms, which you may only see a little bit later. Here it is very nicely shown again on the cinematic rendering. And here we remove the ribs and show you the large mass. Again, this case is a nice example of making the point that aneurysms or pseudoaneurysms can simulate lung tumor. Remember, we can have pseudoaneurysms which occur secondary to lung tumor, but when you see things that look like a mass, you always think about tumor first because that's much more logical and much more frequent. But when something is very round, you got to think about vascular structures. And if you did a non-contrast CT, do a study with contrast before you do any intervention. Make sure you're not dealing with pseudoaneurysms. In this article, we spoke about in the ER setting that pulmonary artery aneurysms, clinical symptoms, cough, dyspnea, hemoptysis. So it can be very, very non-specific. So you really need to be thinking about it. Even in the case of hemorrhage, a CTPA is recommended to determine whether the source of bleeding is from the pulmonary vessels or the bronchial arteries. So again, cases can be challenging. Here's a patient with COVID and DVTs and left-sided chest pain. You can see multiple bilateral lung infarcts. You can see sites of bilateral thromboembolism as well as pseudoaneurysm, the largest which is in the lingula on the left side. Again, very nice example showing you from the axial to the coronal views of this patient's pseudoaneurysm, which was eventually treated with stent placement followed by coil embolization. Another example, IV drug abuse. You can see what looks like an empyema, and then you notice a process in the patient's right lower lung right here, and that you have to be thinking about an aneurysm or pseudoaneurysm. Here it's nicely shown on the MIP imaging as well. Once you find one of them, you want to make certain you're not missing others. And here's just a few more reconstructions very nicely shown in this example. And again, the effusions which are infected, as well as the patient's aneurysm, right lower lung. And again, some additional 3D MIP imaging showing you that. Another patient with IV drug abuse, look at the large pulmonary artery aneurysm, left hilum and left lower lung. Again, you can imagine this would, on non-contrast scans, look like a primary tumor. And in fact, in this case, there are bilateral pulmonary artery aneurysms in both the right and left lower lung, nicely shown on the image on your right. And so again, as I mentioned, even with a large one, you have to look for a second lesion. So here are two very large pulmonary artery aneurysms. Again, going back to this first look, again, very important to look very carefully. Now, we spoke about the management, including aneurysm size and location, the patient's stability, whether or not it's bleeding, and again, treatment from embolization with coiling to resection will depend on the patient, the size of the process, and the clinical presentation. So I've gone through a number of things with you. I've shown you a little bit of the amazing spectrum of pulmonary artery aneurysms and pseudoaneurysms. They're rare, but they're important to diagnose because of high morbidity and mortality. Earlier diagnosis allows for quicker treatment, often with embolization, and the patients will do well. Again, some of the conditions from Behçet's to IV drug abuse are things you need to think about. Again, with IV drug abuse, look carefully at all vessels. Look for vasculitis, whether it's in the chest or abdomen or in the neck. You always want to look very carefully. And with that, I thank you for your attention and hope you have a great day. If you like this video, make sure to subscribe to the CTisus YouTube channel. You can also visit us at ctisus.com for even more videos, plus quizzes, pearls, protocols, and oh so much more. We're also in the App Store and have well over a dozen apps for iPhone and iPad, all completely free. Thanks for watching.